Shoulder pain is quite common in folks. A lot of it centers around the rotator cuff. The rotator cuff is a series of muscles that turn into a tendon and attach on the ball and help the ball rotate on the socket or help to make the shoulder move. Problems that can come from having rotator cuff tears or symptoms can be severe pain in the shoulder, especially with raising your arm over shoulder height, pain with doing anything where your elbow is away from your body, such as trying to reach back to put on a jacket, trying to fix your hair, trying to get something out of a cupboard, or trying to throw a ball with your child. It can also create a significant amount of pain at night. So if you're having trouble, it's important to come in and get evaluated. The rotator cuff, when it tears, has a fairly poor blood supply and does not really heal up on its own. So it is possible that that tear can get very large and eventually become what we call an irreparable tear. And that's why it is important to evaluate it. However, most tears are not complete tears and don't require surgery. Most partial rotator cuff tears simply create a good bit of pain and inflammation in the shoulder and are treated very well with time, rest, physical therapy to help strengthen up the muscles around the shoulder, some anti-inflammatories, and possibly a cortisone injection. And I would say that's how we treat the majority of the partial tears that we see. Some partial tears do require surgery, and only some complete tears of the rotator cuff need surgery as well. For complete tears of the rotator cuff that have not responded to conservative care, typically recommend that we proceed with an arthroscopic surgery. Arthroscopic surgery involves utilizing several small holes about the size to fit a pencil through to go in and shave off some of the bone spurs that have rubbed on the rotator cuff and made it thinner. We then bring the rotator cuff over and then reattach it. This procedure is an outpatient procedure, so patients go home the same day. You're in a sling for a few weeks. Typically, after a few months, folks are back doing everything they want to do.